right, we are live. Welcome everybody, and thank you for joining us for another webinar. If you don't know me already, I'm Daniel. I'm the host of the Psyche Innovations webinars, and today we are joined by a stellar, star-studded group of academics and professionals. So we have Heinrich Grobbelaar with us. Heinrich is an associate professor of sports psychology at Stellenbosch University. Heinrich specializes in optimizing performance behavior and enhancing athlete well-being. His research explores athlete career development, transitions, and lived experiences such as injury and burnout. And since February 2023, he's been the mental conditioning coach for Stellenbosch Football Club, working with both professional and reserve teams, as well as coaching staff. Janja Usenik, a psychologist and physiotherapist. Dr. Usenik is a university professor at the University of Maribor, Slovenia. She earned her PhD in sports psychology at Vrije Universiteit Brussels, focusing on athlete career development and mental health. She currently leads an international research project on athletes' mental health literacy funded by the Advanced Olympic Research Grant Program. Jolan, assistant professor in health psychology at Vrije Universiteit Brussels. Jolan focuses on promoting mental health in sport and performance settings. He has led multiple European research projects, including Dual Careers for Mental Health and the Euphoria Project. Currently, he heads the Erasmus Plus Good Game project on mental health in esports and serves as a performance psychologist for the Flemish Judo Federation. Mattias Dooms, a PhD student at Vrije Universiteit Brussels. Mattias researches mental health in sports, contributing to the IOC project on athlete mental health literacy. He works as a sports psychologist at KV Mechelen's Youth Academy and is the assistant coach of the Under-13 elite team. His education includes clinical psychology, sports and exercise psychology, and applied sports psychology, alongside UEFA pro coaching qualifications. Damn. So if that hasn't impressed you, you can leave. Just kidding. So today we're talking about mental health literacy and mental health literacy interventions. I'm going to be asking our panel of experts some engaging questions. They're going to provide sort of anecdotal experience and some things they know from the literature and research. As we're going, if you have questions that you'd like them to answer, I'll try ask them in the session or perhaps at the end. And if we don't get to them, we'll always comment on them afterwards. So thank you for joining us, to our audience, and thank you to our panel for being here. All right, to kick it off, Janja, you developed a mental health literacy intervention and conducted a 3-country study. What was the motivation for doing this, and what gaps were you hoping to fill in mental health literacy research?
Yeah, hi Daniel, once again, and thank you for inviting me to this webinar. So yes, to jump into it, our motivation for developing this mental health literacy intervention and also to conducting this 3-country study comes from our response to a call by the International Olympic Committee as part of their Olympic research studies. So maybe you know that the IOC recognized mental health literacy as a critical topic within the sports environment, since we know that athletes face a comparable risk of mental ill health comparable to the general population. So we aimed with this project to build on the previous international collaboration on athletes' mental health that we already conducted with several European countries, and I'm sure Jolan could tell you more about it. So our main gaps with the project were to fill the lack of cross-culturally validated instruments, since we created an instrument designed to tackle mental health literacy of athletes. So that was one of our aims. The next one was the need actually for practical and evidence-based interventions. So our intervention study, the second study in our project, aims to test a workshop we called it Athletes Mental Health Matters, that uses a quasi-experimental design. So, but however, this project aims not only to enhance mental health literacy among athletes, but also to provide, let's say, an adaptable intervention that can be later on implemented more broadly in sports environments worldwide. This is why we also decided to do this study in 3 countries, namely in Slovenia, Belgium, and South Africa. Yeah, that's from my side.
Oh goodness, I muted myself. Jolan, I was wondering if you had something to contribute.
Yeah, well, also thanks from my end for the invitation, of course. No, I mean, it's good maybe to also give a little bit of context in terms of what exactly is mental health literacy, because we need to be honest, and it's not a new concept or a concept that we developed, and we've actually been working on it for quite a long time. And as Janja referred to, there's also previous projects that we also conduct on this topic. So mental health literacy in the broadest sense, and what we want to do with these interventions is it's all about the knowledge and awareness that people have around mental health. So that's the basic, very easy, very non-academic explanation about what mental health literacy is exactly. But we can break it down, I guess, in a couple of different components. Historically, because the concept of mental health literacy also kind of evolved over time. Historically, a lot of mental health literacy was about recognizing certain signs and symptoms of common mental disorders. So it can be about recognizing symptoms of depression, of anxiety, of eating disorders, for example. And that's still an important component of it. So recognizing what certain early warning signs might be. But then the construct has also expanded, let's say, in a similar way that our broad concept of mental health has expanded. Now, mental health, we more and more consider it as more than just the absence of mental disorders. So mental health is also about what makes us thrive, what makes us happy, what makes us do well in life, rather than just avoiding the mental disorders. It's also about that positive state of functioning and well-being. So similarly, mental health literacy has also kind of shifted to include that positive component as well, as and understanding what makes us do well in life, and kind of building awareness around some of those components as well. And that's, I guess, what we really try to include in that intervention, those both components.
100%. Sort of building on that comment, Mattias, I was curious from your experience, what makes a mental health literacy intervention particularly effective? And can you share some examples of how you know they work from your work?
Well, we did the intervention already. We don't have all the results yet, so I'm not 100% sure. But I'm convinced there are 2 important factors. First, the willingness on the receiver's end, the openness to learn, to know more about mental health, to break stigma, to really that they are open to learn. I think that's with any intervention very important. And the second thing is the setting. I was giving the intervention in a school environment with 16, 17-year-olds, which was challenging because there is a certain atmosphere. So I think when you really want to get through to the athletes or whoever you want to work with, the setting is really important. So it's something you should think about. But then again, when we were doing the focus groups, all of them were telling me that really the workshop was really valuable, that they were thinking it was important. So I'm pretty convinced that it works. And also some of the techniques they are learning or we are teaching them are well-established techniques they are using in sport psychology. So we know they work.
Just to sort of build on that comment, you said there were a few challenges working with young people with implementing mental health literacy interventions. Could you shine a little bit more light on what those are?
Well, it was a rather big group, so they didn't know each other very well. So when you are working with 16, 17-year-olds talking about a topic that really is a bit taboo or is still a bit sensitive or sensible to speak about, they all want to act tough in a way. So when afterwards I was speaking to them personally, they were like admitting it, like, okay, we know it's important, and I'm sure we will use some things that you were offering us. But in the moment when we were doing the workshop, they just want to act tough, really. And it's understandable. But I'm convinced that it's very important to start at a young age, because mental health literacy is something that affects us all. And you can't start soon enough. But really the setting, that's why I want to mention it. I think we have to know how to reach them.
100%. It's a funny experience where a lot of people will say, yes, I want to learn about mental health and it's all important. But then when it comes down to doing it, people can be a little bit awkward. They don't want to raise their hands and share. And you think, oh, am I actually getting through to people? But then they come to you afterwards and be like, wow, that was really informative. I really enjoyed that. I have so many follow-up questions. I think we think it's a challenge just for young people, but we see it in young adults and adults. So it's a interesting sort of thing that we see across culture as well.
Yeah.
Heinrich, this question's for you. There's growing recognition of mental health challenges in sport. Why is mental health literacy particularly important for athletes?
Yeah, good question, Daniel, and thank you also for inviting us to this platform. Of course, the topic of mental health has become quite prominent in mainstream media because of a lot of elite athletes that over the last decade or so has actually come out admitting and showing evidence and signs of struggling with their mental health. Because for the most part, what we see is the tip of the iceberg. We see these superhuman performances. We think these athletes have got it all figured out. They're on top of their game every day, every single day. And of course, we also think that it's an amazing opportunity and an amazing job that they have if they do it as a profession, which, don't get me wrong, it is. But with it comes a lot of additional risks and pressures. So I think, as Janja alluded to earlier, they are not immune to mental health challenges. They might have exactly the same or even slightly higher risks than the general population because they're under constant scrutiny. They've got exceptional high standards, perfectionism, tendencies for perfectionism that's often required of them in their sports, which places them at risk for certain conditions. It's also got to do with, the unforeseen injuries that happens, lack of form, going through slumps, non-selection. They're very often on contracts, and that's only got a certain duration, and then their contracts might be terminated. So there's a lot of instability and also a lot of fluctuation in what they go through. And so I do think, therefore, this particular topic and just the awareness around it and being open around it and talking around it and engaging with athletes around it is super important and something that, as Matti said, needs to happen from a younger age already. I tend to work with professional athletes. And for some of them, this is new. It's new information, and that's to a large extent, it's a pity. But still, it is something then that we can open up the discussion on the topic and engage around it and get some constructive input and discussions to move forward together.
Awesome. That's great insight. So for more context, for people who are listening in, this team, along with a lot of other people, are implementing an intervention in 3 countries, working with elite athletes, and this mental health literacy intervention is targeted at these young individuals who are athletes. So sort of building on that commentary and what Heinrich was saying about sports psychology and the high performance environment and the skills and competencies that we know help elite athletes perform were considerations that were brought into developing this intervention. So my question then is, Janja, this mental health literacy intervention was developed for professional elite athletes. Is it also applicable to amateur and sort of everyday sports people?
Yes, of course, I would say so. Even our experiences show us this. But I would say, yes, our intervention was specifically designed with professional and elite athletes in mind, like Heinrich just explained a little bit before. But I think the core components of it are highly relevant and also applicable to amateur athletes and everyday people as well. As you said, the intervention focuses on improving, let's say, fundamental aspects of mental health literacy, such as recognizing mental health issues, understanding how and when to seek help, practicing different self-care strategies. And these topics are actually universal. They're essential for everyone, regardless of the level of participation in sport or not. And I would say maybe even recreational sports people or amateur athletes also face mental health challenges that we don't think about that much. For example, they also face performance pressure and they need to balance their sports with other life responsibilities, or they also deal with burnout or injuries. So I would say that this intervention is also relevant for them and also flexible enough to be adapted for broader audiences. Since I would say that all people could have positive effects, for example, by encouraging them to seek help early enough and also to reduce stigma around mental health issues. The intervention very much stresses on supporting well-being, and also by bringing up those topics, we encourage to create healthier environments, also healthier recreational sport environments. So I would say definitely yes, this intervention can be applicable to other contexts as well.
That's great to hear, and it's awesome that you're also explaining some of the core components that go into mental health literacy intervention, which we'll discuss in more detail as we go. Jolan, this one's sort of targeted at you. What are some of the common mental health challenges you see in athletes, and how can mental health literacy interventions help address them?
Yeah, there's a couple of things there. I think one, Heinrich already alluded to it. We see quite comparable levels of, let's say, mental ill health. So a lot of that is things like depression, anxiety, which you also see in a lot of different populations. So it's not necessarily sports specific. There are a couple of mental disorders that are a bit more prevalent. The data shows us that it's a bit more prevalent within athlete populations. Things like eating disorders, for example, in a number of sports seem to be quite a bit more prevalent. So that's definitely something to, let's say, pay more attention to in a mental health literacy intervention that is targeted at sports or elite sports compared to other populations, for example. But there's also a couple of other things. So it's not only about which specific mental disorders or challenges are more prevalent, but it's also the context of sport that can be a bit different. One of the things that we still a lot of times see that the stigma is so big, and it's been already mentioned. Stigma around mental health, it's improving, also with a lot of the attention that's coming to mental health, but it's still quite big in our experience. Just also what Matti discussed, the way that people responded during the interventions was actually they're picking up a lot and they're learning a lot, but showing to other people that you're really thinking about mental health and considering mental health as something important was still quite a big hurdle for a lot of the athletes. So that stigma is still there, and that's particularly something that actually mental health literacy and the interventions, they're built to kind of work around that stigma and kind of address that stigma. But it's not only in the athletes, it's also in the people around the athletes. The coaches, for example, they might also still experience a lot of that stigma. And one of the consequences of that, and that's also a big challenge that I see in sport around mental health, is when someone is faced with mental health problems, it's still a lot of times by the environment or themselves or the other athletes seen as weakness. And a lot of times there's challenges around, for example, selections. Athletes might be afraid that if they open up, if they're honest about their mental health experiences, their challenges, that it might have consequences for their selections, that they might not go to a certain tournament, or they might not be in the starting team the next game. So I think a lot of work needs to be done around that, and that's what that intervention tries to do as well, like raise that awareness, raise that knowledge, try to build a common understanding of mental health that shifts away from it's a weakness and those athletes they're not fit for elite sport, but rather have a more nuanced perspective. And I think it's really useful to target those very sport specific challenges, whereas the concept as a whole is not necessarily sport specific.
Yeah. So a lot of the pressures that you were talking about that are applicable to elite athletes, the selection or work stresses or evaluation, people experience that in other work environments, whether it's corporate or university, trying to get into a higher degree program and all this. So those experiences seem to be quite, unanimous. And what I also picked up from what you were saying is that these mental health literacy interventions is some general themes that are applicable to all of them, but you can sort of provide nuance and more targeted elements of it depending on the audience that you're sort of going for. So that kind of leads to my next question, Matty. Beyond athletes, who else can benefit from these mental health literacy interventions, and how does it apply to the general population in your opinion?
Well, I think any society or everyone in any society will struggle sooner or later with some mental health problem or issues or whatever. So I think Janja and Jolan already partly answered the question. So it's for everyone, really. But I think one of the important things about mental health literacy, or in the intervention at least, is to pick up the signs. How can you see someone is struggling? How can you see within yourself that you're struggling, that you are close to, let's say, mental breakdown, to say it out clear, but it can be a lot more subtle. And I think that's important to get involved, to get everyone involved, not only the athletes, not only the coaches, but also the people around them, brothers, sisters, people in the school, teachers, that they are all vigilant for the signs or the signals. And I think one of the comments of one guy from the focus group was, if someone would come to me and ask me, I see you're struggling, what's wrong? I will open up and I will do the same for him. If I see him struggling, I will go to him and ask if he's fine. So I think if we all recognize the signals, I think we are a step closer to being really supportive, to give the social support everyone really needs, and to create that bond. So yeah, for sure, it's for everyone. And the more you ignore mental problems, the bigger the problem becomes, and the more possibility you need to really seek for professional help, the bigger the cost for the society. So I think not only money-wise, but in general, losing someone, for example. So yeah, I'm 100% convinced that it's for everyone.
That's awesome. I think there's
Daniel, can I come in here and maybe just add something? And indirectly, I'll also address one of the questions raised by Kelsey Andrews. I think what we've seen around a lot of these topics is that there tends to firstly be a very big focus on the athlete and what they're experiencing. So I go back to, say, 2005. Burnout and overtraining was a very big theme among athletes. So a lot of research done on athletes and overtraining and burnout and under recovery. And then there's almost like a 10-year lag before that same topic becomes relevant within the coaches and the entourage. And I know, Jolan, and in Europe, there's a lot of continuous studies on this particular topic, also looking at the mental health of the coaches and the entourage, the people working within the sporting fraternity. Because the situation is often, and this is my understanding or my explanation for it, is when an athlete is struggling, the coach jumps in and does something to help the athlete that is struggling. When the coach struggles, they might keep quiet, because who do they turn to, and what are the risks for them to come out and say, listen, I'm battling with this thing? Because we know that professional coaches, hire and fire is the order of the day. And so the question is, what role does coaches have to play to promote this? I think they've got a huge responsibility and a huge role to play. But one of the things that we saw, and this is just anecdotally, so in the settings that we conducted this research, we got the athletes to complete a lot of questionnaires. One of them was, where would you turn to help, or where would you go and seek help? And from all the data that I punched in, one of the people that are less likely to go and ask for help is the coaches. And again, because the coach eventually makes a decision about whether they select it or not. Even though, in my experience, very often it's the coaches that really has a very caring and creates that understand, or that environment that really cares for their athletes. So they are actually good people to turn to. But then as long as the environment has someone dedicated or opportunities for the athletes to go and seek for that help, or through doing this particular project to enhance their just basic understanding of what it is and also what they can do in the sense of where to turn to for help, or what to do if we see signs and symptoms in someone else. But I do certainly think the environment has a big role to play. And I've ventured into this topic also to have an open discussion on a platform with the coaches and the entourage within the club that I'm working. And it is really something that opened up good debate, good discussion, and also then follow-up sessions on that, because as much as the athletes are challenged, everyone else in that environment goes through a lot of these same things: the pressure, the traveling, the periods away from home, missing out on events. So I do think as a collective, we've got a big role to play, but also to cater for the coaches and the entourage.
Fantastic.
Yeah, and
I'm glad
maybe
you answered that question, because I was actually going to ask it. Just to sort of build on that question, Jolan, I appreciate you wanted to ask something. Should mental health literacy interventions be equally targeted at upskilling the coaching staff and the entourage as it is the athletes? And why do you think that maybe they aren't prioritizing the coaching staff in your experience?
What was that targeted at me, or was it targeted at Heinrich, the question?
It was targeted at you, Jolan.
I can take it. I can take it. It's fine. No, I think Heinrich already said it quite well, and it's indeed something that we're very much looking at the moment. And we also had a big European project that looked at the mental health literacy of the entourage members. And here, entourage members, we consider it quite broadly. So that could be coaches, but that definitely could also be parents. That could be other support staff within the sports setting, like physiotherapists, for example, who have a lot of one-on-one time with athletes. It might be other athletes, but it might also be, for example, in our context, we are a university. We have a lot of dual career athletes, so it's people combining high-level sports with also studies. So it might also be teachers or tutors or responsibles for the facilitation of that dual career. And I think we did a lot of the same principles as we do in our mental health literacy for athletes, but they're kind of other accents or things that we emphasize just a little bit more. And I think one of the things that we really emphasized in mental health literacy, like we said, it's all about recognizing signs, but then it's also knowing what to do when there are certain signs. And that might mean, if I recognize the signs in myself, where do I, as an athlete or as a coach, where do I find help? But it's also, what do I do when I recognize signs in someone else? And that's what we really focused on. And in the entourage population is how do you respond then? Like, what are some basic communication skills that you need, that you can use to start up a conversation around mental health, to express the fact that you are worried, you see certain things and you want to get a little bit more information. There's a lot of different ways that you can go about as a coach, as a parent, to have that conversation. And some might be a little bit more effective or a little more welcoming or understanding, and other approaches might be a bit harsher or might push the athlete a bit more away. So it's really thinking about that. And then it's also knowing where to refer and how to refer that person with those signs, those mental health problems. Because one very important thing, if we're talking about mental health literacy for the entourage, I always emphasize it's not about making coaches, making parents, the sports psychologists. It's not their responsibility to try and really care for people with mental health problems. What their responsibility should be is to detect those early warning signs, because they're the people that are best placed to detect those early warning signs, and then knowing how to guide the athlete or the individual to the professional help that they need. And that's really something that we emphasize for the entourage. And then I would say another component that we emphasized is also looking at their own mental health. How are they functioning? Like Heinrich said, as a coach, a lot of times it's all focused on the athlete, and the coach should focus on the athlete as well, and they should support them. But coaches have a really stressful job as well. And we see a lot of mental health problems in coaches as well. And there might be even more stigma because there's not that much attention for it. In athletes, it's starting to come, but the attention for mental health of coaches, for example, is almost non-existent. So can we have those interventions to start that initial discussion around that as well? So what do you as a coach experience in terms of the stresses and the demands of your job? What impact has that on your own mental health? What do you do to promote your own mental health? If you're struggling with certain things, how does that affect your functioning? How does it affect your performance? But also, for example, the performance of the athletes. So these are all additional topics, let's say, that we had in the mental health literacy interventions for the entourage that maybe are a little less present in those for the athletes.
That's awesome. That sort of leads to one of my other questions, Matty, that's targeted at you. And Jolan was talking about this, is identifying personal and environmental risk and protective factors is a big part of mental health literacy. Can you explain what these are and why they matter? Sort of building on Jolan's comment.
Yeah, when we talk about risk factors, obviously we're talking about factors that really contribute to mental ill health, let's say, or mental health problems. And then we can make a distinction. Is it sport related or is it personal? Is it within the person? So sport related risk factors are more about stigma, for example, being able we talked about it a lot already, but being able to talk about mental issues. Is there an openness? Is there an understanding? Also, the support you receive from your coach, from your teammates, if you're playing in a team sport, or deselection. Obviously, a big part in team sports is, some of them are pretty sure they will play, but most of them aren't that sure. So it's something that really weighs on an athlete, especially a professional athlete that was doing anything to arrive. And then if you don't have that play time, obviously it's going to have a consequence on his mental state, let's say. Then if we go to the more personal risk factors, we can look at injury. If you have a big injury, obviously, if you can't perform or train, you're out of the group. You don't really have a bright, close future or short-term goal, let's say. So that's for sure is hard for an athlete. Then, of course, career dissatisfaction. If your career doesn't evolve how you think it's evolving, if you're close to retirement, you don't have plans or whatever for what you're going to do afterwards, is a big issue, obviously, and negative relationships. Then if we go more on let's say the protective factors, so they contribute to mental health or to help at least a bit with the stressors they are facing. Mental health literacy, obviously, if you know how to look for the signs, where to look for help or whatever, obviously is a protective factor. Also support from the entourage, not only your teammates, but also your parents if you're young. your friends. So you don't have your one identity, the only athlete identity, but your identity is a bit bigger, let's say. And then the satisfactory career transitions, obviously. And then if we take a closer look on the personal protective factors, recovery, really to know when the stress is getting too much and taking a step away, having some techniques you can use. For example, we will speak about it a bit later on, but breathing techniques, mindfulness, just taking a step back from a stressful situation, competency, autonomy, being the author of your own life. Those are all factors that contribute to mental well-being, let's say. And it's important to know those factors, because then you really get in control of your life, because when you know which are the risk factors, you're attentive, you know when to take care or where to look out for, no? And in the other way around, if you are mentally a bit affected or whatever, and you know what your protective factors are, you have something or someone to go to, or you know what to do, really.
Thanks for that insight, Maddie. I think one of the things we've been talking about a lot is stigma. And I think these risk and protective factors, when you hear them, you're like, oh, well, that seems obvious. And I think in some cases it is, and in other cases people just really don't know what is affecting them, and going through it in a more structured way is helpful. But I think stigma plays such a big part in people reaching out. So Janja, this question is targeted at you. Stigma is one of the biggest challenges in mental health. In your view, what are the effective ways mental health literacy can help break down the stigma?
Yeah, Daniel, you're right. We talked already a lot about stigma. Jolan previously explained it very well, why stigma is so common still in sports environment. And it's still one of the most significant barriers, actually, to address mental health challenges. Because I would say that sports environments are still, still prioritize toughness and resilience. But I would say that such interventions like ours can help to break down stigma, and actually in a quite simple way. One of the things that these interventions do is that, like we said, they increase knowledge and awareness of mental health conditions. So when athletes better understand that mental health problems and challenges are common, we all face them, they face them, and they're also treatable, they're manageable, that reduces fear and also reduces misconceptions. The other thing is that in such interventions, we tend to create, let's say, safe space for an open dialogue, which means that we normalize conversations around mental health. So we encourage athletes to share their experience and recognize that when they face challenges, they're not alone. So when they hear the other peers also speak openly about mental health, that creates and challenges the culture of silence. So we break the silence down, and we set a powerful example how to do that. And also what we didn't mention yet, that in our intervention, we also refer to some real life stories of athletes, some prominent athletes who have spoken publicly about their mental health. We all know them, a few examples of them for sure. So that encourage discussions as well, and can inspire athletes to seek help without fear of judgment. Yes, so I would say that it seems simple that these interventions can break down stigma, but in few steps, and like I've explained and the others already did before me, we kind of hope that we create a culture with decreased stigma around mental health issues.
That's awesome. Thanks very much for that insight. Matty, I'm going to circle back to you. You sort of alluded to them earlier. When someone is struggling, what strategies does mental health literacy recommend for managing mental health challenges effectively? Well, what do those kind of like self-care skills and techniques look like? Matty, you're muted.
Yeah, sorry. No, I think the first and most important one is psychoeducation. So people know when to do something, when I have to use techniques, when do I have to do self-care. But obviously, we want to help them to know or to teach them a bit more. So if you're speaking about self-care activities, one of the most important ones is do what you are used to do when you feel stressed. What are you normally doing when you feel stressed out? I'm going out with friends. I'm reading a good book. I'm going out for a walk or a run. I think there are some small things that everyone does, but that maybe sometimes we forget to do because we are so into whatever we need to do, whether it is sports or studies or whatever. I think sometimes we need to take a step back and remember what we enjoyed and what helps us to relax. And then, of course, there are the techniques that really we are using as sport psychologists too, which are the breathing techniques. We're also mentioning in the mental health literacy interventions. Breathing techniques is really to calm the system down. If you take control over your breathing, your heart rate goes down, and your mind receives signals. Everything is under control, so you get less and less stressed out. Mindfulness is really about being in the moment, not thinking too much about the past or the future, but really being in the present. So letting go of the negative thoughts. Body scan is one of the techniques we are teaching, which is really about recognizing tension in your body, especially with athletes. It's important because their body is their tool, is their temple. So in a way, they are very in contact with their body, with their sensations. So with a body scan, you can really check in on yourself and check, okay, if this is the situation stressing me out, should I do something to take down the stress? So if you're talking about techniques, I think these are the hands-on techniques, let's say, but also the seeking support, the seeking help when all those techniques aren't really helping is kind of an important message from the mental health literacy intervention too, because sometimes you can't do it alone. And this is where stigma kicks in. This is like the hurdle that prevents people for taking that step to seek professional help. But it's something we need to normalize, and it's something that really, we have some techniques. You can do the things you know they are working, but sometimes you need more. And I think that's an important message too.
100%. I love how you touched on how these strategies can be used when people are already stressing or feel like there's a big burden on them. And I think part of the conversation is also getting people to appreciate that we should proactively bake into our days and our weeks these techniques, whether it's going to spend time in nature or seeing your friends. You've got more sort of legs in your chair to support you, and not just waiting for when you're stressed and slapping a band-aid on and saying like, oh, I'm doing breathing exercises now, it's going to make everything better. So I love that nuance that you were adding there. You kind of also spoke about the stigma around reaching out for help. So that kind of leads to one of my other questions at Jolan. Help seeking can be difficult for many. How does mental health literacy encourage people to reach out for support when they need it?
Yeah, I mean, it kind of touches upon some of the things that we already discussed. One of the things, it started with recognizing some of those early signs, and a lot of times it's also about having a discussion like what's the difference between normal fluctuations, normal variations in mood, in emotional state, because a lot of times we use depressed in the English language and also in our Dutch language, to mean both I'm a little bit down, I feel a little bit depressed, and it's a clinical disorder. So kind of having that discussion around what are these normal fluctuations in mood, and what's not necessarily something to worry about, and when does it really start leaning towards that clinical side. So having that basic understanding of that difference, if we're talking really about themselves, like knowing, okay, if we know when it starts leaning towards that clinical side, a lot of times it's knowing where to seek help, and that's a very logical one. But we're seeing a lot of research and a lot of data, also the data that we collected ourselves. A lot of times people don't even know. They might have certain struggles and they don't know who to speak to. They might think, okay, my coach, I'm not going to tell him, because then I'm not going to play this weekend. I'm not going to tell my teammates because they will think I'm weak. I don't see my parents because I'm in a boarding school, for example, and they're away. And so it's also difficult to tell them, and they're going to be really worried about me, and I don't want them to be worried. And they don't even know where they can find help. And a lot of times it's quite simple. It's quite easy to at least find that first help, or that first line of contact that you can reach out to. And it starts with having a discussion with the people around them. So that's also part of mental health literacy. Like, who can you reach out to in terms of your personal connections, whether it's a coach, whether it's a parent, whether it's a friend or a partner. But a lot of times, a small part of the intervention is also like, these are the lists of places you can go to, and that will be different for every country, for every context. But there's online help lines, like they can phone in, or a lot of times they have a chat box now where they can send people to. Your general physician might be a first line of contact, depending on the context where you're. So just giving that list, that's also part of the intervention that we set up.
Yeah, 100%. So there's obviously the contextual elements, there's the instrumental side, like telling people to go use a particular mental health app. Obviously, there's all these different resources that people can be directed to. But I think culture and age and all the different sort of variations in the human experience can alter people's perception of what help seeking is and should look like, and how stigma influences them. And that kind of leads to one of my other questions that I'm going to ask to you, Heinrich, and then if the others want to talk about their context, they're more than welcome to chip in. So mental health perspectives vary across culture and nationalities. In your experience with mental health work that you do in your context, what are the key considerations and what adaptations might be needed when talking about South Africa?
Yeah, so you're using South Africa as a good example just because of the multi-cultural, multi-racial, multi-ethnic groups, multiple languages. And so also, and this is part of the reason why we did this particular study. So if you consider that in Slovenia, there's one language, Slovene. In Belgium, there's the Flemish part, Flemish Dutch, and then there's the French part. Just in the Western Cape region where I'm based, it's predominantly English, Afrikaans, and isiXhosa. And across our country, 11 official languages. And so one of the key things, I think, is around language. And that's why we also then went and took a lot of instruments and we translated them into multiple languages to gather data, to collect data, to make some comparisons. But the reality of the situation was that even in settings where we know that there are first language isiXhosa speakers, we didn't get a single respondent answering the questionnaires in isiXhosa. They fell back to the language that's commonly used in the coaching domain within that club, for example. And likewise, even at a traditionally Afrikaans university, Stellenbosch University, we got very few respondents in that first phase of our study who answered the questionnaires in Afrikaans. So, the last part of your question is what would be needed. I would think that we need to translate material into multiple languages. But having done that, that didn't achieve the desired outcome or what we hope to achieve. And then also to make it a little bit more complex is that, very often in these settings where you're dealing with multiple cultures and languages, it's the inability often of athletes to express themselves and to express what they are feeling and what they are thinking and what their behaviors are. And it might have to do with, from the outset, just a literacy problem. It might have to do with the literacy around mental health that is still very much lacking. But I think ultimately we need to do more of this work. To also give you an example around language, and by no means am I a language expert, and I'm not trained in clinical psychology per se, but in certain cultures, a mental health disorder like schizophrenia might not be seen within that culture as a psychological problem. It might be associated to something like witchcraft. And that completely then changes the course of action and also who might get involved. So there's a lot still to unpack and to learn in this setting. But at least, again, and I think that's why just opening up this discussion on mental health literacy is so important, because where in certain cultures it might be a completely taboo topic. We don't go there, we don't talk about these things. Now we open it up into a space and we just hear that others are experiencing certain things that we might be experiencing ourselves. And so at least that is my perspective in the South African context in which I function. If any of the others have specific things to add considering their context, feel free to do so. Janja, Matti, you did the intervention yourself. And everyone listening to this, just note that Daniel, he's very modest. He's actually the guy in South Africa who's implementing these workshops for us because of his expertise and his skill set. So, Daniel, you could also maybe share some of your experiences in that applied setting.
Thanks, Heinrich. I try to just get as much value out of you guys without making it about me. But yeah, you touched on a whole bunch of key things there: the language, how people perceiving different mental health conditions, what literacy level people are at in terms of just general literacy and what they know about mental health. That really changes the playing field. And I think it highlights how important it is to get somebody from the context to contribute to interventions, because nuance can be lost. And I think that's also one of the great strengths of this study, is that there are people from different nations trying to find, what are the universal elements to these interventions that are super important, and what stuff does need to be contextualized, and how can we measure improvements in these different contexts to see what is the key sort of, like, I always say the meat and potatoes, the main thing that makes it work, and what's sort of less important. And in saying that, Janja, Matti, I don't know if you have sort of different perspectives or anything to add on the sort of like cultural contextuality sort of discussion.
No, I would just add something from our perspective. So we did our interventions mainly with young elite athletes, so aged 16 to 18, 19. What was obvious in our culture is that mental health is still very much connected to stigma. So we've faced some challenges with opening up the conversation about it, and also with debunking some myths around mental ill health and athletes. So I would say that our culture is still very much connected with stigma. A lot of fear with showing especially signs of mental struggles, and also help-seeking behaviors. Yeah.
That's awesome. Matty?
Sorry. Yeah, I think in Belgium it's not very different. There are some athletes, popular athletes, famous athletes that are opening up in the last years, and I think that's important. Not only athletes, but important people, or at least popular people in the society that speak about mental health, about mental ill health. So I think it's a problem it's a responsibility rather than a problem of the society, and I think we can do a lot getting the stigma a bit less and less, but some people need to step up, let's say. And I think, like I said in the beginning, setting is crucial. If you want to get to people, it depends who you have in front, and you have to speak the language. You have to speak the language they want to listen to. And maybe sometimes that can be a teacher, but it can be a coach, and it can be a sport psychologist, or it can be a brother or a mom. So it depends. It depends on the message. But I'm sure that everyone, in the end, everyone is interested, but not everyone is willing to share. So I think there we have to find a way to adapt the message to the receiver.
100%.
Maybe if I don't know if there's time, if I can quickly jump into the question, because I really appreciate the question. I'm not sure that from my perspective, have a lot of the answers, because I think one part of it is that we should acknowledge that there's a lot of research on mental health literacy in sports. It's coming up now. In other areas, it's been around quite a while, but we need to acknowledge that the vast majority of the research has been done in Western, let's say, white, rich populations, and that really limits our ability to kind of with confidence say that it will also work in other areas. So I really appreciate the question, and I really appreciate the project as well, because it looks at these different contexts, these different cultures, and I think a lot more research needs to be done there. And I really liked Heinrich's point as well. Like, we also need a lot more research, but we need qualitative research. Listening to people, talking with people, how do they have conversations around mental health, and not just the survey, but also really listening. What's their conceptualization, like the detailed conceptualization of mental health. So that's really one point I want to raise, and also acknowledge that I am from that Western world. So I'm limited in my capacity to say what it should or would look like in other parts of the world. I think another challenge that we definitely also run into is the language around mental health. Because even just in this webinar today, we talked about mental health, we talked about mental disorders, we talked about mental health problems, we talked about mental concerns, and it's often used a little bit interchangeably. But if you go really academic, they might mean just something slightly different. So it's already a challenge, like which words do we use in which place, and without it becoming too academic. But then it's also the issue of translating those to our own languages, for Dutch or Slovene or Isikosa. It's like, how do you translate all these different terms and in a way that it doesn't become too academic, but still you kind of maintain the nuance around the conversation around mental health. So that's definitely also one of the challenges that I see when it comes to implementing it in different contexts, in different cultures, different languages.
Yeah, 100%. There's such a balance between making things too academic and having them accessible, but you want to put in the key elements that that work, but you can't make an intervention super long or too short, and that's the balance for research and academia, and then practitioners as well, who are trying to do this important work, whether it's in schools or workplaces or in no matter the setting. And that kind of leads to our sort of like wrap-up question, which is also for you, Jolan. We know that mental health literacy isn't just for athletes now after this discussion, even though this research project was for athletes. And it's a skill set that benefits people across different areas of their life. In your view, how important is it for mental health literacy to be integrated into these different settings, sports, workplace, and education? And what steps can these sectors take to foster better support and understanding?
Mm-hmm. Yeah, good question. A very big question. It's a good question to leave until the end. Now, I definitely believe that it's very important. Like Matty said, there's still data coming out of this project, but other projects, other research has shown that it's a really effective first-line intervention. So it's a very broad, and that's important to emphasize. It's really the starting point to then make sure that there's other things. But mental health literacy is not the end-all, be-all. I mean, if we want people to understand what our certain signs are, knowing where to seek help when they think that they have an issue, like decrease the stigma around help seeking, well, we also need to make sure that there's help in place, and not that they reach out and they come on a waiting list where they have to wait 6 to 8 months, which is the case now in Belgium, if they want to seek professional help. So that's a thing that we can think about. Okay, how is this now building towards other forms of support? We talked about self-care, some of the basic principles there, but again, mental health literacy is about raising that awareness, to have a think about what are some of the things that you might do, and then building on that, you could have a much more in-depth, for example, mindfulness intervention, where people really learn in detail, in depth, like how to use those mindfulness skills in their own life. And I think probably the most important point for me personally is don't look at mental health literacy as a sort of a tick box exercise. I think the big risk is with talks like this, is that an organization will say, okay, this is really important. We have the workshop. We're going to do the workshop one time. And now that's a check. And we've done our mental health work for this year. And that's it. No, it's creating that foundation, that starting point to normalize mental health, to make it a part of the day-to-day discussion, to create a culture of psychological safety where people feel comfortable sharing their experiences, speaking up. But it's a continuous effort, and it's not just the one exercise, the one workshop. Okay, now it's done, and we've done our responsibility. So I think that's an important, for me, key take home message.
100%. And sort of as we wrap up, I just want to speak about how we at Psyche Innovations, we do mental health literacy interventions. We've been doing them for a few years. And it sort of builds on what Jolan was talking about, that mental health literacy is a key skill set that's seen in a broader range of skills and competencies that individuals or organizations can really benefit from, whether they're academics or practitioners or workplaces or schools. So if you would like to sort of reach out to us and hear more about those interventions that we do, or psychological first aid, and how we sort of make them continuous care, please do. Obviously, there's been so much that we've discussed today, and this topic is really complicated, and we try to get as much out of the experts as we could. So I encourage you to please reach out to anyone from the team if you have further questions. The researchers are obviously doing other projects as well, which are awesome. So I really encourage you to engage with them. And just from my side, I just want to thank my panelists for being here and for sharing your wisdom on a Thursday evening. And thank you to the participants for joining in. I hope you gained something from it, and please feel free to leave comments after the event. We'd be more than happy to answer them. So thank you very much, and we'll catch you in the next one. Cheers, everyone.
Thanks for the invitation.
Thank you very much.
Thank you.